You hear a general practitioner talking to a patient named Sarah Gleason. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes. Sarah Gleason, come in, please, have a seat.
Hi, doctor. Thank you.
So, what can I help you with today?
Well, I'm a little worried because of a couple things, actually. I've been taking a combined oral contraceptive pill called Monofem to help me, well, for more regular periods. They've been a little crazy the last few months, so the last GP prescribed it for me. The first few weeks I thought I noticed something, like I just felt different somehow, a little off, but I thought it was just my body getting used to it. But it hasn't been getting any better, so I want to check that out. And the second thing is, well, I'm worried I may be pregnant.
Okay, well, look, let's start with how you've been feeling and then we'll move on to that because it will be helpful to establish the symptoms first. Can you describe those for me?
Well, the first thing I noticed was these really bad headaches. They kind of spread out all over, but they always start around my right eye, and they just seem to last for hours. I'd take some paracetamol, but nothing would change. I tried drinking more water and just resting in bed. They just kind of stay there, and they're like nothing I've ever experienced before. On top of that, I often get really nauseous as well. I've never actually thrown up, I only get the sensation, kind of like motion sickness.
Okay. These symptoms are quite common actually. Is there anything else?
Well, I've definitely put on some weight. I think it's about 5 kilograms. I just feel really bloated, and I mean, that's a lot to put on in a short time. Until recently, I also noticed some spotting, and it definitely wasn't my period. It just started happening at the oddest and most inconvenient times. But now, well, it's stopped altogether.
Okay.
That's why I'm really worried, because the truth is I sometimes forget to take the pill. If I forget, I try to take the second one on the same day, like my last doctor told me to do. But, well, a couple weeks ago I forgot 3 days in a row, and then I started taking the sugar pills by mistake. I just got so confused. Obviously my partner didn't know, so he didn't use a condom. Then once I remembered, I went to the pharmacy to get the morning after pill, but I think it might have been too late. I almost bought a pregnancy test at the same time, but I was feeling far too nervous then to even take it to the counter.
Okay, a blood test can confirm it, although this may take a couple of days to get the results. These days, a home pregnancy test is very accurate and you'll get the results far sooner, but confirmation is needed before making any changes to what you're taking now. Until then, I'd strongly advise using other forms of contraception.
Okay, but is it possible to have a urine test here in the clinic now? My friend had one of those, and I think I'd prefer it. Once I leave here, I might chicken out again, and I'd rather just know now.
Of course.
And also, I think regardless of the results, I should maybe go over all the information about the pill again with you because I find it all a little confusing. If the result is negative, then I'd like to try again with a different brand and try to be a little more responsible with taking it. Maybe it would be a good idea to make a family appointment too, if you wouldn't mind. I think it would be good to bring my partner along so he can learn all about it too. And if the result is positive, well, it's a good chance to go through everything together.
I think that's a great idea on both accounts.